Oh, I wish I was skinnier. Hello?
Hey, how are you?
Hey, how are you?
Good. Do you already have your dress for our Christmas dance?
I don't. I can hardly fit into anything. I'm too fat.
But do you remember Ashley from middle school?
Is she that round-faced, chubby girl?
Yeah, the chubby one.
Yeah, I do. I haven't seen her in a long time.
Yeah, remember she always takes her insulin to her at school?
Yeah, she's diabetic too, huh?
Yeah. Oh my gosh, I saw her today in the mall, and she's not that chubby, round-faced little girl anymore.
Really? What did she do? Did she find a miracle diet?
Well, she's like thin and gorgeous, you know? And so we got to talking, and she shared with me that she stopped taking her insulin, and that's what made her skinny.
Really?
Yeah.
By not taking her insulin?
Yep.
Does her doctor know?
No, she didn't tell her doctor. She didn't let him know. She said she feels great losing all those excess pounds, that she just decided not to do her insulin anymore. Oh, my mom's calling me. I gotta go. I'll call you later.
Okay, bye.
Bye.
Would just not take this. My mom will never find it here. I'm gonna go weigh myself now. I hate being fat. How much weight I've lost. Yes, I might fit in my dress. Yes!
I've noticed that all you're taking in is water. And you're losing a lot of weight. What have you been doing?
Mom, I'm just not that hungry. Quit bothering me.
Where do you think you're going, young lady?
I have to go pee. Is that okay? Mom! I don't feel very good.
Christina, what is going on? Christina! Christina, what is happening?
Mom, I don't feel very good.
What have you been eating? Your breath smells like fruit soaked in acetone.
Oh, nothing. I haven't been taking my insulin. Oh my gosh, I'm gonna call 911.
Okay, so what are you guys learning about in class this week?
We're learning about diabetes and DKA.
Okay.
Yeah, have you ever had a patient come in with DKA?
Yes, I have.
Yeah.
Do you know what causes DKA?
Yeah, I think so. It's, first of all, you have to have diabetes.
Okay.
So you're diabetic. And then also, I found this acronym called MIGS. It helps me remember it, but it stands for myocardial infarction,
Okay.
infection, GI bleeding, and what else?
Sepsis. And
Oh.
yes, you are right, diabetes. Because you need to have diabetes before you can progress to diabetic ketoacidosis, right?
Right.
Okay, very good.
Yeah.
Okay, so Nicole, what do you think you would find in a patient with diabetic ketoacidosis?
Well, I think we would find a patient that comes in and is tired, lethargic, probably decreased loss of consciousness, and nausea, vomiting, I think, and stomach pain too, right?
Okay. Have you heard of gastroparesis?
Yeah, it's when your stomach muscles aren't working properly, and so it just can't empty very well. It can cause nausea and vomiting, and I believe gastroparesis can be caused by diabetes.
Very good. Wow, I am very impressed with your knowledge. Those Carrington College professors are doing a great job with their students.
Well, not to mention all the countless hours spent studying and lack of sleep.
Patient coming in, type 1 diabetes, possible DKA.
Hey, it's your lucky day. Your patient is coming in. Go show me what you've got.
All right, let's do this.
Is my daughter gonna be okay?
We will do the best that we can to help her, okay? In the meantime, you can go to the waiting room and we will just update you of her status.
My tummy hurts. Oh God, I'm gonna get sick.
Hello, my name is Pearl and I will be your nurse today. And this is Nicole. She's my student and we will be helping you today, okay? Can you tell me your name and date of birth?
Christina Roque, December 13th of 96.
Christina? That's a nice name.
Okay, I want you to get her vitals and do your assessments.
Okay. All right, so I'm just going to take a listen to your heart and your breathing.
Code blue in room 504, code blue.
Okay, so just, I'm going to take a look at your eyes and see how you're doing.
Okay, Nicole, what's her vitals?
Her blood pressure was 95/60, respirations were at 24, heart rate was 140, and her O2 stats are at 95%.
Can you tell me what happened?
I just felt really lightheaded and I passed out or fainted.
Okay, does your stomach hurt?
Yes, it hurts really, really bad.
Okay. What's your pain level on a scale of 0 to 10? 0 being no pain at all and 10 being the worst.
Oh, it's at least a 9.
Okay. So I gather that you have type 1 diabetes. Are you taking your insulin?
No. Does it matter? It didn't bother me when I first stopped taking it. Just now.
Okay. Smells fruity.
And like acetone.
Okay, her lips are very dry, her eyes are sunken, and she is very thin. She's very dehydrated. Can you take her blood glucose?
As much as I'd like to do her finger stick blood glucose, I can't because per Carrington policy, I'm not allowed to, and I follow the rules. But I can help you get the IV started.
Oh, her blood glucose is 600. She is rapidly progressing to DKA. I have the doctor's orders here. Give a bolus of normal saline, 1000 ml, over 60 minutes while we wait for her labs and ABG. And after that, she needs to be in the ICU.
Okay. Okay, so I'm going to go on ahead and start your IV. I'll get my gloves.
It's gonna hurt.
You are going to feel a poke, but it's important that we put the IV in so that we can get you hydrated.
I just want my mom.
She'll be here soon. Okay. Her urine analysis came back with ketones at 4+.
Okay, so here is the patient's lab report. Can you tell me anything about it?
Sure. Sodium is low. Potassium is within normal limits. And her chloride is high. Her bicarb is low. Her calcium is low as well. Glucose is very high. Her BUN is high, and her creatinine, albumin is low, and her pH level is also low. Her CO2 is low, and her oxygen is within normal limits.
Very good, because our goal is to replace intracellular and extracellular water and correct electrolytes deficits. We did that already. In the ICU, the patient is in NPO. Normal saline with 20 potassium acetate and 20 potassium phosphate was administered, which ran for 85 ml an hour, and regular insulin was infused at 3 units an hour.
Okay, and I think we also want to be checking her blood glucose as well, right? Hourly, we check her blood glucose, we want to check her output and make sure she's peeing, and we also want to check her potassium.
Yes, and why are we checking her potassium?
Yes, we want to make sure we check potassium because when we give insulin, insulin is not only drying out the glucose and bringing it into the cells, it's also bringing in potassium. So it's very important to check potassium because we want to make sure that it's okay because that has to do with the heart. Potassium levels can rapidly decrease once insulin therapy starts, as insulin drives potassium into the cells, leading to hypokalemia, which is life-threatening.
Very good. So, what should we make sure that the doctor has ordered?
We want to make sure that the doctor has ordered an EKG because we want to make sure that there's no dysrhythmias or arrhythmias present.
And ABG too. Hopefully, they are going up. We want pH above 7.34, bicarb above 21 so she can get out of metabolic acidosis. And also, once blood sugar starts at 250, we are going to administer 10% dextrose. Do you know why?
Okay, we want to make sure that we give her the dextrose because we wouldn't want our patient to become hypoglycemic. And also we have to watch out for fluid overload because that can also cause cerebral edema.
Good job, Nicole. You are very smart. That's why I like working with Carrington College students because you people know your stuff. Okay, so now it's time to do some patient education. Hi, Christina.
Hello, nurse.
How are you feeling?
She's feeling much better. Thank God.
Very good. So, you have type 1 diabetes
Yeah.
and you have stopped taking your insulin. Why is that?
Well, you see, I had this dance that I get to go to, and I bought this dress, and I was having a hard time fitting into it. And a friend of mine told me that she has a friend who just stopped taking her insulin and lost a lot of weight and looked amazing. So I did that because I want to fit into my dress.
Okay.
I'm tired of being different. I don't want to be fat. I want to be skinny. And I thought that was a good way to do it. But then I ended up at the hospital.
So, Mom, did you know something about this too?
No, this child is driving me crazy. She just wants to make me rip out my hair.
Okay, so let me tell you something about DKA. Diabetic ketoacidosis is a life-threatening complication of diabetes. It results when the body cannot use glucose as energy source due to absolute or relative insulin deficiency. The body compensates by breaking down fat stores to use as fuel or energy, which then produces ketone bodies. Excessive ketones in the blood can cause serious problems. It alters the pH balance, makes body fluids too acidic, causing metabolic acidosis. Symptoms of DKA are vomiting, fruity acetone breath, excessive thirst, loss of appetite, and abdominal pain. Dry mouth and decreased skin turgor are often accompanied with breathlessness, leading to tachycardia. As the blood sugar levels rise, the kidneys cannot retain the excess sugar, resulting in its excretion, which increases urination and causing dehydration. That is why it is very important for you to follow your insulin therapy religiously. You have diabetes type 1. That means your pancreas is not producing insulin. And mom, clearly, she needs help with this. She's one lucky girl. A couple days more without treatment, she would not have survived. Okay, I am going to discuss your medications. Since you already had breakfast, the insulin infusion has already been stopped. The doctor ordered a dose of 13 units of Lantus, which we will administer on your abdomen or wherever you usually do your shot. This will be every 24 hours starting with breakfast. Lantus is a long-acting insulin which will provide you with your baseline insulin. Then we will give you Novolog, which is a rapid-acting insulin. The dose will depend on how much carbohydrates you are taking and your blood glucose level. Right now, you are on a diabetic diet. We have to follow this therapy until your blood glucose levels become stable and you can be discharged.
Yes, so with your diabetic diet, some foods that you can eat are whole grains, some vegetables, some fruits, fish, and you can have poultry, some chicken, and beans. You want to make sure you're getting your protein. Okay. Okay. Do you like those kind of foods? Do you like fish?
Yeah, sometimes. Sometimes I like sweet food. Can I ever have sweet food?
It's better if you try to stay away from sugar as much as possible. But every now and then, of course, everybody's got a sweet tooth. You just have to be very careful and limit yourself with how much you eat. And of course, you'll always be checking your blood sugar levels.
Yes, that is correct. And now I am going to leave you these pamphlets. This is about diabetes and diabetic ketoacidosis, the medications and the treatments, and that will help you understand the disease process.
Okay.
Okay?
Thank you.
Do you guys have any other questions for us?
Do you have any questions?
I'm just gonna read over this brochure now. Thank you.
Okay, so good luck.
Thank you. Thank you for taking such good care of me. Good luck
Just want
in
you to
school.
get better. Thank you.
You're gonna make a great nurse.
I'm sorry, Mom, that I did this. I won't ever do it again.
It's okay. All that matters is you're safe now.